ask them what's going on. Hopefully they're going to tell you where they're hurt, and then you're going to start to fix it, okay? If they're knocked out or they're not telling you what's wrong, if their arm's missing and they're not saying my arm hurts or nothing's wrong, then you're like, okay, I need to do a full assessment. And then you're going to do a blood sweep. And this is where you need to check each other out. Someone falls down some rocks, they're not conscious, and you're like, hey man, what's wrong with this guy? Maybe they fell on a pruned branch and the branch is sticking out of their abdomen or their chest, and you can see that. Maybe you don't see it right away. Maybe they stabbed themselves with the branch and then they sat up and it's kind of hard to tell what's going on. So you're going to do a systematic sweep from head to toe on the front, the sides, and the back. And it's just like making a peanut butter and jelly sandwich. You got to have a method. Whatever you pick, stick with it so you don't miss something. But you want to check everything. And we train medics to use their trauma shears to cut off the clothes and actually look and feel, what's going on. So in your first aid kit, you should probably have a headlight. You can use a flashlight and put it in your mouth if you want to, but a headlight, they're cheap, 20, 30 bucks. Make sure the batteries work. You can put it on your head and then you don't have to hold anything in your hands, and then you can kind of see what you're doing. Check their head, check their face, their neck, the whole front of the torso, run down the arms, then roll them over on their side or ask them to sit up and look at their back. You're going to want to get them naked. We call it trauma naked, because you, especially in combat and car accident scenarios, injuries can hide. So if there's a hidden injury and they're bleeding, they could die. And I told you that arteries, kind of like your calf can cramp up, your arteries can cramp up too. I once had a guy who was missing an arm from above the elbow. So it was like a mangled mess in this area. This appendage was gone, and there was no bleeding. And it was from an explosion. And so I was like, holy mackerel, there was so much heat that it cauterized the wound and they're not bleeding. I went ahead and put a tourniquet on, but I didn't put it on very tight. It was on there relatively tight, but not really, I didn't cinch it down. And in about 15 minutes, blood started spraying out and like hit me in the face. And I was like, holy crap, like it's re-bleeding. What had happened was that artery went into a spasm, just like your calf muscle can, and it totally shut itself off. So it was his body's way of saving his life. So arteries have a muscle band in them, like a water hose, but a band of muscle, and those muscle bands can tighten up and it can spasm and it can totally occlude itself. So the moral of the story is when you put a tourniquet on, you have to put it on tight. So you really pull it really, really hard, lash it down, and then give it enough turns to where the pulse goes away. And then you look and you're like, okay, I think I got the bleeding stopped, but you're not done. Once that tourniquet goes on, you are married to that tourniquet, and you need to check that thing like every 15 minutes or more, okay? So if you have a bunch of people, usually we teach this wagon wheel where I'd be in the middle and I would start laying people out around me so I can just do my little 360 and kind of keep an eye on everybody. If I just have a few people, maybe I'd kind of stack you guys up over here, but I'm just systematically checking, going up to each person and making sure there's no more bleeding. And that's where sometimes I'll have to put on a second tourniquet. I might have to repack a wound, but you never fully have fixed the problem. You're just sort of temporizing it. Okay, you're just kind of putting a patch on the tire, pumping it back up, and now the leak, instead of being a big air leak, is a slow air leak. It just has to get you 50 miles down the road to the next gas station where you can have them properly patch or repair the tire. Does that make sense? Okay. So we're going quick, guys, but we've talked about massive hemorrhage, arterial bleeding, big pumpers. You're probably going to have to use a tourniquet, direct pressure, airway. If I go up to that same car scene and there's a guy choking on his own vomit or he's not breathing, the first thing I'm going to do, I'm going to bring him over to his side in what we call the swimmer's position, where I use his arm as a pillow, bring him on his side so if he vomits, it's going to go down and away, because a lot of people die choking on their own vomit. And unfortunately, that's a lot of drug overdoses or alcohol, okay? You want to kind of get them on their side, and you'll take their jaw and you'll pull their jaw out of their way, and you'll give their chin a little bit of a lift. And it's called the jaw thrust and a chin lift. 2 moves. You can use them both the same. Or we have these little nasal devices. It's a little straw about this big, but it's straight, and you will kind of take that and you'll stick it in their nose straight back. It's not down, it's straight back, and it goes in their nasal passage, comes out at the base of their throat, and it allows that place to open up. So now they can breathe through their nose. You'll see that in all the basic first aid kits. The more advanced first aid kits will also throw in an oral airway, which is this guy right here, and you just stick this in their mouth and it just holds their tongue away. So what'll happen is your tongue, your big fat tongue, will fall back and close off your windpipe or your trachea, and this guy will sit in there right at the teeth. So this is where their teeth are, and it'll hold the tongue out of the way, and you will not like this in if you are awake. So this is really only used for people who are passed out. But the nasal guy you can put in people that are awake. Okay, so that is the A in airway. The respirations you guys really won't be able to do a whole lot about. Okay, you will see in the military first aid kits they do have a decompression needle. If I can find mine here, I don't know where this guy right here. It's a needle, and so what happens is you have two lungs, okay? And this is, I usually have a better little visual aid, but if this little blue bag is your lung and this bottle is your chest cavity, your diaphragm drops down and then the lung fills up that space, and there's not supposed to be anything between the lung and the side of your chest wall, okay? Well, if I'm shot or stabbed here and there's a hole inside my chest cavity or my bottle, what'll happen is the lung will kind of shrink up. You see how the lung's it's kind of shrunk in there? There's some space in there. And what will happen is that space on the outside of the lung trapped in my chest cavity will get full of air or blood, and it'll crush the lung. The lung is really like a bag or a balloon. It'll crush it so that it can't inflate. So what we have to do is take a needle, we have to stick that in the chest and decompress the chest, or put a chest tube in. So that's a little bit more advanced, but you will see that, and if you go in the military, you'll learn how to do that. There's a really good Mark Wahlberg movie from the 90s where he's like in Three Kings. We use that, a lot of medics use that video, Three Kings, Mark Wahlberg. I think the plot is like they're in Iraq and they're actually trying to steal some gold or something, and one of the guys gets hit in the chest and gets a sucking chest wound. The air gets sucked into the chest, the lung collapses. They have to use a needle to decompress it, and there's some really cool visual, some footage of kind of like this lung and inside a chest cavity that we use quite a bit to explain that, but a little bit more advanced. Circulation, that goes into CPR, the cardiopulmonary resuscitation, where you actually make a kind of a fist, you push on their chest, you pump their heart for them because they can't do it. It also goes into stopping the bleeding so the blood has a place to circulate too. If it's falling onto the floor, it's not recirculating. The C. And then the H, as you guys experienced last night, the biggest thing to prevent hypothermia is to stay warm, which is easier said than done, especially when you're wet. So you'll learn tricks on how to do that. I always have a space blanket. There's a couple shoved in here. These little Mylar shiny silver blankets work great under your jacket. Keeps people from getting cold. When you're cold, your blood doesn't clot and then you bleed to death. So you need to stay warm for your blood to clot. Our body temperature, anyone know what it is? You guys are getting sleepy, and that's okay. 98.6, close to 100. So somewhere around 100. If you're over 100, you have a fever. Usually it's kind of 101, but 98.6. Our body does an amazing job at staying in that temperature range. We drop a couple degrees below, you start to feel really nutty. You get really low, you start to get super goofy. Euphoric is the fancy word for that. You start taking your clothes off, thinking you're hot. You start thinking everything's super funny. Kind of like if you get hypoxic up in the mountains, up in a plane, you don't have enough oxygen, things get real funny and goofy. Start taking your mask off, talking about nutty stuff. You need to warm those people up, okay? You stay dry, stay warm. I kind of gave you the talk about wool is better than cotton. Sometimes the best thing is to get the wet clothes off and get near a fire. So in my first aid kit, I always have some kind of a space blanket, some fire starter, some little fire pellets, and then some matches and a lighter, something like that. If you can't get a fire, guys, sometimes you're screwed. Sometimes in the military you can't have a fire. I say most of the time you can't have a fire. It's just this, I smelled your smoke way down there. And just a little weather story. In the morning, that air is going downhill. So anything you do up here, sound and smell, all is going to flow down. That's called katabatic winds, and anabatic winds are when they warm up and go up the hill. You don't need to know that, but you'll learn it later. But just so you know, you don't want to get cold, and then you don't want to get too hot. And then that H is also head injuries. And once again, unfortunately, you are not going to be able to do much about that, except I'll tell you a little bit about head injuries. If you look at someone's pupils, look at the person's next to you. If they're awake, look in their eyes. These are pupils, these eyeballs we have, kind of like flashlight lenses. They are amazing. When you look into bright sun, those things shrink down. When you look into the dark room, they open up. You go to a movie, it's dark in there for like 2 hours, and you walk out and things are super bright. That's because over the course of the movie, your eye has opened up the aperture 100% because it wants as much light as humanly possible to come in. This is why big rifle scopes and big binos are better, because they let more light in, but the bad thing is they're too big and bulky to carry around with you. But when you're talking rifle scopes, like that big ass, like 35 whatever millimeter or 50 ginormous lens in all that light, those guys are going to be able to shoot past dawn and dusk. And the guys with the tiny little circles for their lenses will not be able to shoot past dawn and dusk. Your eyes, when you look at someone with a head injury, one pupil will be off from the other. So most of the time, 99% of the time, these guys go together. They will get big and small together. If you get whacked in the head, let's say I get whacked on the right, the left pupil, because it's sort of wired backwards for some reason, will be what we call blown. You'll look in their eyes and like one pupil super wide and one super pinpoint, like tiny little black circle, big old black circle. You have a head injury there, and that's a problem. You can't really do much about it besides call medical support and say you have a head injury and get to help. If you fall and smack your head and have clear, look watery, white looking stuff, that's spinal fluid coming out your ears, that's bad news too. That means you've cracked that membrane in there and you now have spinal fluid leaking out your ears. That's bad news. And as far as it's hard to, you can't treat it in the field, you got to get to someone that can treat a head injury like that. And that's not just any small hospital. That's somewhere with a neurosurgeon on staff. But the one thing you will know with those people is you got to start moving, get them to aid, which means you got to start thinking about how you're going to evacuate. And then you guys did litters last year on how to transport people. Okay, if we have time, maybe we'll let you have a break and then we'll work on transporting people, because I know you guys are tired. How are we doing? Did some of that register? It's important stuff, guys. I know it's kind of boring when you're sitting there and you've been up all night, but hopefully you don't ever need this stuff. But when someone gets hurt, people freak out, and a lot of people don't have the training that you just got, and it's sad because people do wacky stuff and they start moving people and hurt them more, or they don't have any idea how to do direct pressure. They don't know how to put a tourniquet on if someone were to give them one. I'll tell you a story. I gave this little talk to the Maine state troopers, kind of the highway patrol, when I was living in Maine. And they were a cool bunch of people. They just got tourniquets, didn't know how to use them, gave them like a crash course, hour course, did some mannequin stuff and some drills, and it was okay. They were getting paid to be there. Couple weeks later, I'm on this trauma call in the hospital, and this person comes in, and they had an older lady got her leg amputated. So then I was like, holy mackerel, and there was a tourniquet properly put on. So I was like, shit, I'm going to find out who this trooper was. So I looked through the record and found him. I gave her a call, asked her if she'd come in, and I'd talk to her with the trauma surgeon. And lo and behold, she had taken the class that we'd just given them, because they just got tourniquets. And I told them, hey, take it out of the package, get it ready. And she had told me, this is a true story, she said, you said we were going to freak out and it was all going to be nervous. And she's like, you were absolutely right. So the story is, she's parked across the street, got a cup of coffee, just starting her 8 o'clock shift, dry cleaning place across the street opens. Older lady in her 80s is out, going to take her dry cleaning out of the back of her car, bring it inside. She opens up her old trunk of that ginormous Oldsmobile that she has. She's leaning down in there to get her stuff out. And this young college girl, unfortunately not paying attention or not knowing how to park a car, came in behind her, didn't put it in park, for some reason hit the gas instead of the brake, and pinned her legs between the two bumpers and severed one of her legs, completely severed her legs. Old people are fragile. It doesn't take a whole lot of trauma to do that. And so now this trooper, who hasn't really even started her shift, hasn't even gotten her cup of coffee, is like, holy crap, what is going on over there? There's a lady pinned between two cars. So she goes over, This lady backs out. The young girl backs out. So now this old lady's crumpled up on the ground, kind of screaming, bleeding out of this severed leg. And she runs back to her car, grabs her first aid kit, pulls out her tourniquet and puts it on. And she said, even though I had it ready, I had a hard time pulling. I didn't have it tight enough. And then she fiddled with it. And then luckily the fire department was just down the street and they came. And she didn't even know if she put it on right. She was so nervous. I said, you put it on right. That's great. I'm calling you because this was like a success story. And she's like, oh my God, I was so scared. I thought you were calling because I didn't put it on right, because she was kind of so emotionally worked up that she couldn't even remember. She remembers she struggled with it, but she couldn't remember if she had put it on all the way. And luckily she had. And that older woman did okay. I mean, she was banged up a little bit, but she didn't die from blood loss.